A visit to the gynecologist's office usually starts out with a medical history. It's very important to know ahead of time if you've had any major health issues or if you have any family history that might affect you personally, such as breast cancer, ovarian cancer, or colon cancer. The doctor will ask you some in-depth questions about your personal history, about your periods, and about your medication. So it's very important to have all of that information whenever you come in. The second part of the exam usually is the physical part of the exam, and your doctor will generally start from head and then move down to the lower area of the body. The gynecologist will typically listen to your heart and lungs, will examine the thyroid, and then we'll move on to the breast exam. Your breast exam is very important. That first visit can teach you how to do a breast exam properly, and then your gynecologist will probably reinforce that you should be doing self-breast exams on a monthly basis, usually a week after your period when all the tenderness is gone. The last part of the exam usually involves examination of the pelvis. So your gynecologist will typically first look on the outside to examine to make sure that all of your outer genitals are normal in appearance and free from any signs of infection. The second part of that exam usually involves a speculum examination. This is a typical speculum, and it's about the size of a tampon. And usually what the gynecologist does is inserts the speculum in toward the cervix and then opens it up to visualize the cervix. The cervix is that part of your anatomy where the Pap smears are done. And that's usually what most gynecologists are focused on in terms of doing your Pap smears. The Pap smear is only used to detect cervical cancer. Most women think that it can detect other things, like problems with your ovaries, but the Pap smear is specifically targeted at picking up cervical cancer, so that's very important to know. So your gynecologist may ascertain lots of other information about your vaginal health and about your inner organs like your uterus and your ovaries and tubes by examining you digitally. Information that cannot be ascertained simply by doing a Pap smear.